Acuity levels are really to help you know who to address first in times of crisis. This is very much part of emergency planning. There are, of course, other times that we use this, but all of the times that we use acuity levels are around prioritization of whatever it is we're prioritizing. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about acuity levels. But first, if you like our content, please like, share, and subscribe. So what are acuity levels? Well, before we jump into that, I do want to talk about one little thing and just put it out there. I am not a clinical professional. I'm not a clinician. I'm not licensed. But occasionally I will be talking on some clinical ideas. Please, anything that I say that's just clinically related or charting related, always double check with your DPCS and people like that. The things I comment on or I'll talk on are just what I've seen in my experience and what I've learned. But since I'm not a licensed clinician, it's best to always confirm this stuff with a clinician. First of all, because they're educated in this, but secondly, because they are required to keep up their education with continuing education units. And so any changes or updates to methodology or whatever, anything like that, they will have the most up-to-date knowledge about that stuff. So I just wanted to throw that in, and now let's get started. So what is an acuity level? An acuity level or an acuity category is pretty much a way of categorizing patients into groups based on their needs. And so what we're really trying to do is we're trying to establish levels of care in terms of like who has the highest needs, like a medium level of needs and a lower level of needs. People approach acuity levels in different ways. Sometimes they're called just what they're called, Sometimes they're called high, medium, and low. Sometimes it's 1, 2, 3. Sometimes it's 3, 2, 1. So for the sake of this conversation, we're going to call them high, medium, and low acuity. So the reason that people will call them different things is that it's up to you what to call them. I've seen them actually expressed in colors as well, like red, yellow, and green, and things like that. And so because there's so much variation on how people call or categorize the acuity levels, saying low, medium, high, I think like really conveys the concept of it. But and this is kind of a compliance little pitfall too, is that if you're purchasing policies and then using a software, you want to make sure that your acuity levels match everywhere. But anyways, that's for later. So what are acuity levels? These are categories that help us understand how much care a patient needs and what kind of care a patient needs. I think it's pretty self-explanatory, and usually people get this after one explanation. Generally, when somebody is admitted into home health, hospice, or any other clinical setting, they're going to be triaged into one of these 3 categories. There could be more than 3 categories, but for the sake of simplicity and just generally what I've seen, it's been 3. So patients in the low acuity category are typically your lowest level needs patients. This could be patients, for example, that are just receiving teachings, no direct care. Maybe they are generally independent or their condition is stable and you're just teaching on new meds or new disease process and things like that. But they're not like at risk of hospitalization all day and, things like that. They maybe live with somebody in the home or have an active caregiver. So maybe their needs are a little bit higher, but they have an active caregiver that can take care of them. And so to the look of the company, meaning to the home health or hospice agency, you could still be in a lower acuity category if you just have all the support around you and they kind of know how to deal with their conditions and they're not that unstable. One clear indicator of a low acuity patient is if the frequency is in a once a week pattern. If you're visiting once a week, or even, the 2 week two and then 1 week, whatever, those frequencies, those are typically going to be for your low acuity patients. That means they just need you there once a week. You're not like actively doing things for them in this extreme way. So, what it means when somebody is low acuity is that if a visit is missed, and that's not to say that we can or should miss visits, but if your visit is missed, they're not going to go into some kind of like health crisis, pretty much. So, that's pretty much the low acuity category. It's just your lowest level of patients. I'm going to contrast that now and jump into the high acuity category. So the high acuity category is your highest needs patients. These are patients probably on some kind of like IV, complex wound care. You are definitely doing things for them. This is not the teaching. This is very much direct care services. This could even be a diabetic BID insulin patient with no caregiver, no family members that can help them, things like that. This is somebody who's at a high risk of hospitalization. Their condition is not stable usually, or maybe it is stable, but you're just doing really hands-on and like complex and direct care for them. A couple of things for these patients. If you miss a planned visit for these patients, this is like very bad. It's like missing an IV visit, right? Like you can't miss an IV visit, and you can't miss like an antibiotics dosage and things like that. So this might be a high infection patient and things like that. Then that leads us to medium acuity patients or moderate acuity patients. And this is pretty much the people who don't fit into low acuity, don't fit into high acuity. Like they're not like so simple that like you're just teaching stuff, but they're not like, really unstable and on the verge of something or whatever. So this is probably somebody, some kind of examples of these patients could be, maybe you're just performing teachings, right? You're not doing any kind of direct care, but then there's also a therapy on there. Maybe they're like in terms of nursing, you're just doing teachings, but then there's like therapy, right? Or maybe there's like two kinds of therapy. Maybe they're functionally just like really depleted and things like that. And so pretty much the way that you really can score moderate acuity is that they're not low and they're not high. They're kind of in this gray area in between, and that's your moderate acuity. It could be people that you are doing direct care for, but there's active caregivers. You're teaching the caregivers. Some or all parts of this direct care. There's a family support system. They're not like super unstable in that they're a high hospitalization risk or an extremely high fall risk and things like that. So that's your moderate acuity patient. Typically, the people that set the acuity category are going to be clinicians, so they're going to have a really clear idea of where this person falls into. My general recommendation, again, I'm not clinical, so feel free to ignore my recommendation in this, but if you're between two acuities, just throw them in the higher one. And that's because of what we use this for. Why are we categorizing these acuity levels? It's not just for fun, right? Like it's not to, let's say, even prioritize resources, because when you take a patient on, you are essentially committing to providing the full care that's needed. Like you can't admit a patient and then let's say they need occupational therapy and you're like, I don't have an occupational therapist, so you're just going to have to go without that and we're just going to do nursing. So acuity levels are really to help you know who to address first in times of crisis. This is very much part of emergency planning. There are, of course, other times that we use this, but all of the times that we use acuity levels are around prioritization of whatever it is we're prioritizing. Because we've been doing a lot of talks around emergency planning, just in general in our pods and our articles, I'm going to use emergency planning as the prime example. And I really think that is the prime example of when we use this anyways. And so in the kind of idea of emergency planning, you are prioritizing who you're going to talk to or who you're going to visit, which patients, based on their acuity levels. Because depending on how many patients your company has, you may not have the time to go through 400 patients to see the exact care needs, like the exact details in like a major crisis, right? Like in a major emergency. And we're filming this on July 11th. So last weekend was that big flood in Texas, it's just really heartbreaking stuff. And so anytime there's something like that, it just really makes us want to talk about emergency planning, because not to say that that's any of the tragedy there is related to this, but it's always a good time to remember about and practice your emergency planning and whatever you can do around it. And so that's why we're talking about acuity levels now. So when we are in a big emergency, what we're doing is we have to check on all of our patients, all of them, regardless of what acuity level they're in. But depending on what acuity level they are part of, you are going to check on them differently and at different times. So the high acuity patients, of course, are prioritized, and they need to be seen within 24 hours of a major emergency that would require your company to declare an emergency. Then you have the medium acuity patients, and you want to see them within 48 hours or less. So it's 20 for the high, it's 24 hours or less, 48 hours or less. And for the low, it's 72 hours or less. Now, you're still calling everyone the first day. So that's not to say that you're not going to touch base with your low acuity patients for days, after an emergency. No. But in terms of physically visiting and checking up on them, it's easy. 24, 48, 72. And you just really want to stick to those time frames and visit them, make sure they're okay, do a little wellness check. When we say or less, what we're really talking about is if that person already had some scheduled treatment or procedure or something that they need within that time frame, especially with the high acuity, that's what the or less is. If you had, if there's like a big earthquake in the morning and then like you had an injection or something planned for the evening for a high acuity patient, you don't get to reset your time to 24 hours now and go the next day. So that's what we mean by or less. You still need to keep your scheduled commitments as long as it's safe and feasible. Otherwise, they need to go to the hospital or, whatever, seek some other kind of treatment. But pretty much you're still responsible for doing your general basic visits. But now we are also doing some kind of wellness check in the face of a giant emergency. And so that's really what you're using acuity levels for. It's to help you prioritize and understand what level of care you're going to provide in these times that you don't have time to review every single case. Yeah, if you have 10 patients, maybe you do. But if you have 100 patients, 50 patients, 200 patients, now we really need these categories to properly react to various situations that can come up. If you are somebody who is kind of piecing your compliance together, like you buy policies from here and then you kind of pick up some other things from there, and then you're like using your EMR and all these things, which is the average home health and hospice agency owner. This is not something out of the norm at all. You really want to check in all those places if they mention acuity levels and how they are calling them or categorizing them or scoring them, because I've seen a lot, like policy groups will have category 1, for example, as low, and then the EMR will have category 1 as high. And then I don't know, or like there's color differences, or like your EMR might say 1, 2, 3, and then your policy calls it red, yellow, orange, or whatever. So just make sure that the names of the acuity levels are the same throughout all the text of your programs. This is a very easy, simple thing to do, and it's just really going to improve your compliance. So that's my little pro tip for that. And that's acuity levels. Thank you so much for tuning in. And as always, I'm Mariam Treystman from the Home Health Consultant. And if you like our content, please like, share, and subscribe. Thank you.